Sawasdee. Good afternoon. I am delighted to welcome everyone to join our conference via Zoom and here in this room. Today I am be sharing the insight of the Spiritual Healthcare in Action program in Thailand, which is we often refer for its short name SHA program. This program is our innovation and initiative in Thailand. We focusing to integrating spiritual care and spirit at work in healthcare setting. To begin, I would like to sharing about the person-centered concept. Person-centered concept is about the holistic care approach, which is we emphasize the need of each individual unique value and preference. In Thailand, the concept of person-centered care is particularly significant as it dual involve focus both staff and patients. Staff is a backbone of the medical care. They are work hard and work tirelessly to ensure that the patients receive the best care possible. So in SHA program, we recognize and we respond these professional needs and value. For patients, in SHA model, patient is like the heart of the model. Patient, we recognize that patient is a person first. We recognize that patient is a person who was sick and dealing with suffering, and we respect them. We treating a patient as a person, and to give the healthcare with dignity and respect. We respond to the employees' needs within person-centered care in the organization. So in SHA model, how we can create person-centered care. We have to building spiritual core value in organizational culture. This is a very creative essential factor to building the spirit at work and quality of life as well as spiritual well-being. We also building the culture of embracing empathy, understanding between staffs, healthcare staff together, and between healthcare staff and patients. And this is the foundation of what we call is sense of connection community in organization to make them work together. We can build the harmony, teamwork, and productivity of work. We also developing the tool of deep listening and to have the deep understanding between the healthcare staff and between healthcare and patients, so we can understand the problem from the holistic perspective. We design for and deliver for the staff experience and prioritize their needs to collecting the data to be the strategy for nurturing the spirit at work for the healthcare staff in the organizations. This enhancing the climate of the spirituality culture to have to increase the spirit at work of the team. We also accept in the difference between age, between the occupational in the hospital. So they accept the difference and embracing the value of work more than one. We move from work by ourselves to work in the team. We also creation the trust and co-creation among the team in the organizations to make the sense of connection community. And we also respect for the individual, recognize and valuing each employee's unique contribution, perspective and experience. So it's leading for the meaningful of work. In organization, we focus on personal, individual, for example, personality, value, belief, purpose of life, purpose of work, the knowledge, skills, and another abilities of among each healthcare staff. We also focus to the subjective employee experience by talk to them, by deep listening and talk to them and ask them what they need and what is the problem of each personnel while they are working in organizations. The concept of collaboration and inclusivity, it is more vital than ever because it's the foundation of sense of connection community. So we can build a culture which they have very deep relationship and work together, support each other, and have a united purpose, the same purpose while they are working in the organization. We also have an opportunity for the personal development, providing opportunity for professional and spiritual growth together in the same time. And we also help the employees to reach their need or the purpose of their right or the purpose of their work. For the meaningful of work, it is characterized by the sense of purpose and fulfill the daily life of each career or their work. It's about like finding the value on the routine work in everyday life, and they feel like they support something matter for the organization. So that is a meaningful of work, which we enhance this meaningful of work a lot in our child program. We also have the like the positive communication, using a deep understanding for ensuring the transparent, honest, and trust in the community. We enhance deep listening and compassionate listening, which is very important tools in child model to understanding each other more than ever. Self-reflection is the another powerful tools for build professional growth and human growth in the organizations. So another one is we try to capability with the person organization fit with organizational value and employees value. The value of organization and employee value must be matched with one another. So we have the same purpose and unite purpose. Now let's move to the patient-centered care. What's the meaning? First, the patient care in Thailand, we have to recognize or remember that patient is a person first. So we're thinking about each patient unique, what they need, what is the master of them with our kindness and respect. We learn a patient as a whole person, not only just for the disease or illness, but we know the whole story of them, and we have to learn about what is the need of the patients or what the matters of them. So I have a little bit time to sharing about the story of patients and his pig. This story is from the small hospital in north of Thailand, from Pua Crown Prince Hospital in Nan Province. This is the true story from everyday life of one nurse. This is the story of one man from the Hill Tribe village, and he was suffering from kidney chronic disease and need to be treatment in the hospital for medical facility and training program. I think for myself, this story is a heartfelt journey, patient-centered care in northern Thailand. So when these patients admit in the hospital, they have to start to be receive the treatment and training program for self-hemodialysis when he back to the village. The first day or the first day, this patient really engaged for the treatment and he commit for the training program. But after that, for a few days, the nurses observe that these patients not happy as usual. He have some problem inside, and he not engagement with the treatment or even the training program, which is they love to learn. So the nurse asks the patient with kindness, "You look unhappy. How can I help you? Is the training this day is too difficult for you?" So the patients look like hesitate to tell the true story to the nurses, but eventually he said that, "Doctor, so in Thailand, patient always call everyone doctor, even nurse or any person in healthcare setting. Doctor, I want to go home for a few days. I'm just worried about my two pigs. The two pigs are on sick. I have left them for several days. You know, my father gave these two pigs for me before he passed away, and I raised them since I was young. Without them, I cannot stay." So his connection to his pig was very profound. The nurse understanding and respect of this circumstance, and then this nurse reported to the medical team for this decision. So the medical team was very nice, and I want to share you that this hospital have been recognized by SHA program already. So the medical team acknowledging his deep attachment and decided I want to call that it is a compassionate decision. The medical team decided to allow him short visit home to care for his pigs. So because they understanding the patient's personal circumstance and respect his way of life. After 2 or 3 days, the patients come back again with have happy face and smile on his face and look happy. And he brought some vegetable and some strawberry, fresh strawberry from his farm. And this is a gratitude gift for the medical team and his nurses. And more than that, these patients very engaged for the treatment and commitment for his training program, because he want to have a quality of life and well-being when he back and stay with the family and his two lover two pigs. So the story, we have a lot of this true story in Thailand, and all of them remind us that not just only treatment or healing, but the more than that is the relationship and understanding and empathy with the patient is the heart of patient-centered care, is the heart of person care. So I would like to thank you for the owner of this story,คุณอาริรัตน์จินะ from ท่าวังfrom โรงพยาบาลปัว Hospital. Yeah, thank you. So we treat the patient as a person and receiving the healthcare with dignity and respect, what the way we have do in Thailand in our SHA program. So we recognize that patient is a person first, and the person is an individual and identity, a history, a cultural and personal background. And the last, the patient is the secondary role in the person. So the patient, the first role is a person, the second role is a patient. He is a person who suffering from disease and happen to be a patient later. So we have to recognize this concept. So the patient role is, we should understand that the patient role is I am a person responsible for my body and health and seek to be achieve my self-care. And health is just a resource for what matter of to me, and care system guide and support patient to have health on his condition. And for the professional role, we are just a visitor in their life, and the patients invite us to invite the professional to guide and support what matter by using our career and evidence and experience based and knowledge and skill to support the patient. That's all. So now the conclusion is care professionals are the visitor in the patient's life, and the patient care concept is about the quality of personal, professional, and organizational relationship. It's about relationship. It's about relationship between human and human. It's about relationship between doctor and patients. It's about relationship about professional healthcare staff and with healthcare staff together. HA Thailand, we recently design the holistic program, what we call ISHA program, and we encourage the hospital on Thailand to use this concept to implementation in the organization. So this program we design for the comprehensive factor to nurturing the healthcare staff in the organization to have the spirit at work and then have the spiritual care for the patients. This model have several factors to which is very significant to provide the spiritual culture in organization, and in each factor they have very important to play in the effect to the spiritual growth in organization. For example, leadership, vision, core value, strategy, organizational culture, work design, and we have some the team what we call is child facilitator, child facilitator to promote spiritual skills and guideline for the practice for the our staff. And we also have the spiritual dimension support to know that which dimension is organizational have to support more to nurturing the spirit at work for the healthcare staff. Then we go to spiritual care with the patients, and we also have the healing element to support both staff and spiritual care. So for this model, we leading to person center. So person center in Thailand, we focus both healthcare staff and patient together. So everyone in healthcare setting must have the well-being and spiritual growth. Now we move from doing alone to working together under the CHA program in Thailand. Our basic purpose in CHA program is we focus to human-centered healthcare, and we balancing biomedical and spiritual aspect of care. We inspire and nurture the human spirit to healthcare staff, and healthcare staff can provide a human dignity in healthcare personal and patient care system. We in organizational we have the dimensions factor to effect for the nurturing spirit at growth as we explained, which is nurturing healthcare personal spirit. We also increase the team human spirit by have the 4 dimensions: the inner life, purpose of life, meaning of work, and sense of community. Spiritual care is the part of a CHA model because the patient is a heart of a CHA model. So for patient, we have the spiritual care integrated and aligned across the healthcare service system with the highest quality. And we have healing environments. Then everything come to the concept of person center. Now we support the spirituality into the organizational structure dimensions, effect on healthcare personal spirituality. That's what we explained already. We enhance employee well-being, quality of life, provide the employee a sense of meaningful work, consider the interconnected relationship to our being and the need of human being in organization. It's hard, but we can move it step by step to meet this concept. We also support the consistent approach to be safe and high quality spiritual care for the patient, families, and staff. So in terms of patient care, we integrated both safe and spiritual care and high quality. We enabling the person, staff, and patient to access their own spiritual resources. So this is what we do for the person center in Thailand. So we work a lot to encourage the on-hospital and healthcare facility to bring this concept into the patient care and environment. For example, we have training program, we have training course, in-house training, and hospital visit. We also building the networking for quality improvement, such as hospital accreditation collaborating center, quality learning network, and child member hospital. And then finally, we have a certificate that after me, Dr. Shiren will go further about how to go to the certificate step. So I think that now it is the time for human dignity in healthcare system, and happy to be here to sharing with all of you via our conference. And I think my time is up, so thank you to attend my presentation. Thank you.
So may I start my part? Okay. Thank you for introduce me or advise me to share with you. So I will take a part that follow with Metoi, because in the spirit I call Metoi. In the formal form is Dr. Duong Samon, right? So that's some spirit as well. So I will continue. Okay, that's my slide. Actually, I will start with the CHA basis. The basement of the CHA, we with faith in humanistic, we believe that. So the belief go to the structure that we set up. So we believe that everyone has their own soul, right? Everybody has that one. The human being has goodness, and the seed of goodness within them. I am Buddhist, so I just think only if you have no goodness, you cannot be human. Okay. So the third one is human want to do good at their work when if they are in the working period of the life. And the last one is human want to be a part of society because they want to be somebody. They don't want to be nobody in the community. So the whole thing that we believe to be a humanistic or the dignity of the human. So human is the situation. In this situation, we meaning of the in the healthcare provide situation. So we means both healthcare provider, patients, and their relative altogether. So our CHA model that Dr. Dongsuwan has already explained to us, we intend to be a system of human care by humans who understand each other on a spiritual level. That's our soul to be getting the CHA up to practice. Okay, that Dr. Tongsman mentioned before. So we see, we call this one is the 8th chapter of the guideline for achieve the CHA model for the organization. So the left side we have 4 chapters. The first 4 chapters, just like in the hard side, we call point out that we will go this way with this strategy to make a culture of the organization to be like a spiritual culture. And that one is like we can design our work with by their own. Okay. For the right side, for another 4 chapters, we mentioned about how to get into the practice to promote the skill and practice of spiritual that will make the spiritual level of the person will going up, and then we explain about the spiritual dimension that we have to support. That Dr. Dosmon have already mentioned about the four, components of the spiritual dimension, and then use that one to go to the patient that we call the spiritual care, and the healing environment is the part of the STAR model as well. So, and this model will make up to growth mindset of the both patient and healthcare provider, and then will enhance team performance and harmony. That's all. The outcome of the treatment is better, getting better. So when we implement this CHAR model to be in the institute for practice, in deploying the CHAR concept into the practice, we aim to recognize the organization that implement this model using the program and disease-specific certified that already established in the HAI organization already. We call PDSC, that means Program and Disease-Specific Certification, and dash CHAR model as well. So we have to use an approach to divide into two main tracks. The first one is the creating the learning of the, the organization to clear the issue that what is CHAR and why we have to use CHAR in the organization. This concept and idea to organization executive first, because in the new generation, like generation Y, right? In this, area, they need something called the outcome that can measure. Every executive, they need that one. So we have to make something in another part, prepare for the certification in the touching outcome. So about the learning throughout the organization, we organize training for various organizations. This scheme or this cartooning is explain you about the disease-specific certification is one of the recognition system of the HAI, HA Thailand. So CHAR attached in this area because it's a special program for the organization. You need not to do this one. It's not accountability, but it's just like if you need to creating or build up the spiritual at work for your organization, we have the guideline for you. That's all. And if you use that one for running the organization, we have to have another one to recognize. We call recognition system. So we set up, for the left-hand side, just like we call guideline for spiritual patient care system. We have 8 chapters in that booklet, and the right one is we try to integrate the CHAR concept into the ordinary HA standard, hospital accreditation standard. We try to integrate with that one as well.